Well, hello and welcome to HealthLine. I'm Jennifer Blomquist. I'm so glad you joined us tonight. We have a lot of regulars who tune in every week, and I really appreciate you coming back. That's wonderful. And we get some new people every week, and so that is also great. And for those of you who are new to our show, I want to remind you that we are live here in the studio, and we have two great guests tonight. We're going to be talking about something called Precision Health, and they are more than happy to take any questions you may have. This involves things like genetic testing and kind of it's more of a proactive approach to keeping yourself healthy and avoiding maybe some serious issues down the road. So call in if you have a question at any point. We're going to start talking about this specialty of medicine, but the phone lines are open now. So there is the number at the bottom of your screen. And we also have a text number. That's something we just started a few months ago. So you can call in, and that number is 969-2720. If you're outside of Fort Wayne, it's still a free call. You just put 866 in front of there. And then that gets you through on the phone line. Texting is almost the same, one-digit difference, 969-2730. And I want to remind you that your text number, your phone number will remain private. So don't have any concerns about that. All we ask is if you text, if you feel comfortable giving us your name and maybe where you're calling from, that would be great, along with your question. So everything's good about your phone number. It won't be displayed by any means. We don't want you getting the whole Fort Wayne area calling you at home. So let me explain how the phone thing works, though. If you call in on the phone, my preference is that you stay on the phone line and you can ask the guests the question live. That way they can talk back and forth with you. You might be able to get a better answer that way because maybe they need more information to help you. If you prefer not to do that, I understand. Just tell the call screener your question and they will give me your question and we'll get it answered that way. So one way or the other, lots of ways to get free advice tonight. So let's go ahead and introduce you to our guests. They are new. They've never been with us before, and we certainly hope you come back. Sitting next to me is Dr. Jamie Renbarger, and you are Chief of Precision Health and Academic Medicine.
Yes.
And then next to you is Dr. Emily Powell. And Emily, your title is Senior Scientist, Precision Health. And I'm sure a lot of people at home, like when I first got this topic, was like, well, I'm not sure if I'm familiar with precision health. Can we just give a brief explanation of what it is?
Absolutely. Want me to start?
Sure.
All right. So precision health is something I'm just incredibly excited about. I've been working in medicine for, gosh, over 30 years, and really was in my training when genomics, you mentioned the word genomics, was really taking off. The Human Genome Project had come to fruition, right? And we started learning a lot about DNA and how we can use DNA both to help us in predicting risk for developing certain diseases, as a way to, preemptively start medication, screen for certain health conditions like cancer, as a way to either catch things early or prevent them altogether and allow people to stay healthy. And then the other thing that really falls under this umbrella of precision health is also using genomics or other what we call biomarkers, things that help us predict how somebody's going to respond to medication.
Okay, yeah.
Right, so that we can pick the best medicine for the right person at the right time at the right dose, so that if we're using a medication, we're using it as safely and effectively as possible.
When I was doing a little research, I read a quote from a doctor who said, this is not a one-size-fits-all type of specialty. You don't just rubber stamp it. It really heavily emphasized the fact that everybody is different. And so, you don't think about, you think, use this medicine to treat this disease, but maybe that's not what's best for that individual. Maybe there's something else you have to look at, which is interesting, so.
Absolutely. And, there are just so many areas that precision health applies to. And I think one of the wonderful things about Emily and I having the opportunity to work together is this is also an area that we're continuing to learn all the time. And make new discoveries that continue to push the field forward, which is really exciting, and allows us opportunities to incorporate research and learning into doing the best job we can taking care of patients.
So is this, I was curious because we are doing next week, we're doing a show, we haven't done one for a while, but we're doing a show on integrated medicine, which that was a new thing in the last decade. And the doctor that I've been working with, like she had been an OBGYN and then took, education to, advance herself in this other field. So is this kind of what's going to be happening with precision health? I mean, will there be medical school students that will graduate in this specialty like integrated medicine is now, or is this just something that, maybe depending on, like your background was in hematology and oncology, and then is this just something somebody may do along with another specialty?
Yeah, it's a great question.
Yeah.
Great question, and I would say what I would predict, right, is that genomics and precision health are really permeating every area of medicine.
Yeah.
And so as opposed to integrative medicine or even something like cardiology or oncology you mentioned, as opposed to precision health being a specific specialty area of medicine, what I anticipate is that we will really work to support providers of all kinds, physicians and advanced practice providers of all kinds, to really be empowered to integrate this information in the same kind of way they would integrate other lab tests patients get done, or scans, radiology tests patients get done into care, right? As opposed to it being sort of a separate specialty area.
Okay.
Yeah, that's what I would imagine.
Yeah,
today.
And it is fascinating. I think people, Dr. Powell, I think a lot of people started hearing about the BRCA, gene for, women wanted to know, am I predisposed to getting breast cancer? And they were taking, some women were going as far as having a double mastectomy, saying, I have they were testing positive for the gene and did not want to risk it. And I think that got people that was my first introduction was, to it through a family member who actually did that because there's so much breast cancer on my husband's side of the family. And some of the women they said, I just got tired of going to every mammogram and thinking, is this the one where they're going to find it, And so they just opted to take a more proactive approach. But that's probably, kind of, I think spurred people's interest in this as it came from the breast cancer issue.
Sure, yeah, that's a really important example. So it's, personalized medicine is kind of synonymous with precision health. So it's taking an individual approach to your health based on your genetics, but also your environment, your lifestyle, things like your diet. And so you're right that, just like things like eye color and hair color tend to run in families, risk for certain diseases like breast cancer can also run in families. But just because you inherit a specific mutation in your DNA that might predispose you to developing a disease like breast cancer doesn't necessarily mean you are going to develop that disease. So the whole point of taking this approach is to, like you said, be proactive. So to get those earlier screenings and really empower people to take charge of their health, with the idea being that if you can catch cancer like breast cancer early, you can get to it while it's still surgically removable and very treatable.
And does environment play a role? I mean, you have no control over the genes you get per se, but but can you change your lifestyle and even the environment in which you live? Can that even overpower what the gene brings to the equation? Or
I think that it's not just a black or white thing for sure, but it can definitely impact your risk. So if you know that you carry a risk factor in your DNA, you can be more specific about the choices that you make. Like make sure you get your mammograms early, maybe eliminate alcohol from your lifestyle because we know that's a risk for breast cancer development in and of itself. Things along those lines, diet, exercise, all of that.
Right.
Absolutely.
Very interesting. We do have somebody who sent in a text, so thank you, Wesley from Fort Wayne. He was asking, how current is DNA testing and how are the results used? So, if somebody came to your office and said, wanted to do DNA testing, is that something that's on the cutting edge?
Yes.
Universally, would you say?
Yeah, absolutely. You want me to?
Because sometimes I feel like it starts on either coast and then gravitates to the Midwest. Sometimes we'll talk about certain fields of medicine. They'll be like, oh, they've been doing this on the East Coast for a long time, but here in the Midwest, it takes a while to become something an everyday use. So
yeah, I would say incorporating DNA information or incorporating genomics into care is really at the cutting edge of medicine, particularly as it's integrated in with in the field of precision health. Right. Certainly, we've known about DNA for decades,
sure.
and people have used tests to look for very specific genetic changes associated with diseases, for example, like Down syndrome or even genes that predict risk for cancer in a very targeted way.
Yeah.
The current approach and the approach that we use both in our research and in our clinical testing varies some on a case-by-case basis, but a lot of the work that we're doing is really looking at the entire genome or what's called the exome, the meaty part of the genome, right? The part where a lot of the actionable or most important information is stored. And so that is really cutting edge care and science. And the information, the second question was, how is the information used, or how are the results used? And again, I would say that is the way that we do that is really on a very much a case-by-case basis.
Okay.
So we're not mining the information for anything super secret, but really looking at what we call clinically actionable or things that clinically make sense to look for in individual patients. Does that make sense? Anything you want to add, Emily?
I think it's also important to kind of distinguish the, a lot of times when people think about DNA testing, they're thinking about things like ancestry results. So you can go and kind of get a kit online.
That's a big thing now.
Yeah, and so you can go buy those yourself and send in your DNA swab.
Is that just usually a swabbing your inside of your mouth?
Yeah.
Okay.
Yeah, but if you go to your doctor, they're going to order a much more sophisticated test that will, have a much more accurate result. They will sequence more of the DNA or maybe even all of the genes, like Dr. Renbarger said. And so in those cases, a medical expert is actually interpreting the results and making those clinical decisions accordingly.
That's how. So that would be the gold standard, is to because that is a big thing. You mentioned the ancestry types of kits, and we just did a program a few weeks about colorectal health, and some of those people hate getting a colonoscopy, and so I think the allure is, all I have to do is send in a little sample in this mail-in kit, but even that physician was saying that's just not the gold standard. The gold standard is going to a physician and having the official testing done. So
Absolutely.
I just want to remind everybody, because this is such a fascinating topic, please feel free to interrupt us at any time. We're going to keep talking about precision health and maybe some things you want to think about for yourself, for your family, any loved ones. But like I said, we'd love to have you call in, or you can text in, just like Wesley texted us a message. That worked out really well. So the number again to call is 969-2720. And if you want to text it in, again, we keep your phone number private. That doesn't show up on the screen. It's 969-2730. I wanted to ask about just how should people approach this? Is there a certain age at which you might say, is it kind of like, should you get a baseline screening done per se? Like we talk about, we've done hearing health programs, and a lot of the audiologists will say, when you're 40, 45, you might want to just get a baseline so that we know how it's changed as you age or things like that. Does that apply to this field, or do you only really pursue it if you perceive an issue or you have a family history of something?
Yeah, that's a great question. I'll go ahead and start us off, and then feel free to chime in, Emily. A lot of it, you mentioned family history, and certainly in individuals who have a strong family history of a life-threatening or life-altering illness.
Sure.
Cancer, you mentioned, being at high risk for cancer, cardiac events, or at a individuals with a very high risk or a strong family history of heart disease,
Sure.
or heart disease developing at an earlier age, individuals, again, requiring a lot of more intensive care. Those would certainly be clues that might say, yeah, testing, doing precision health testing to evaluate you for specific risk could be really important and can help in preventing illness. And that is certainly one really important approach that we're taking. We are also, as part of our program, we also offer screening for certain very high-risk conditions, 2 genetic cancer predisposition syndromes, as well as familial hypercholesterolemia. And the reason that we do that is even in the individuals who have no symptoms, who otherwise seem healthy, that we know that these particular conditions affect up to 2% of the population. And the vast majority of people, 80+% of people who carry one of these genes, isn't aware that they, either because
until there's
they don't have a family history, right?
Okay.
Exactly. And so by doing the screening testing, getting the information back, it's actually a way to preemptively initiate screening or medical treatment, or even, as you mentioned, early or preventive mastectomies as a way to keep somebody safe. So.
And it's been years, but we had a geneticist on years ago who was talking about, because I would feel like that kind of falls under this umbrella, that, counseled a lot of parents, prospective parents, maybe that had a history of Down syndrome in their family. And, and all children are loved, whether imperfect or not, but you always want to do what's best to try and have a healthy child. And so I wonder, is that something that's going to become commonplace where people might look at their risk factors, if nothing else, to be prepared that, we have a good chance of having a child with a certain kind of condition, just to mentally prepare yourself for that?
Yeah. No, absolutely.
Yeah, I think so. I think that's definitely the way that the field is going. And I think even beyond just mentally preparing yourself, it allows you to take action to make sure that you are seeing the right specialists and, providing the right type of medical care if the child does have a rare disease or a predisposition for developing a disease like cancer.
Yeah.
Right. We did get another text message, so I don't want to ignore that. This was from James in Fort Wayne, so thank you, James. He is asking, how does DNA become damaged from things like smoking? I guess I never thought about the lifestyle and environmental factors affecting your genes.
Yep.
Yeah.
Yep. So cigarette smoke has hundreds and hundreds of carcinogens in them. So those carcinogens are chemicals that either disrupt the ability of your cells to repair its DNA. So every time your cell has to divide to make, heal a wound or replace itself, it needs to make another copy of its DNA. And there's this machinery within our cells that makes sure that that process is accurate and that mutations don't happen. Mutations can be thought of like spelling mistakes in your DNA. And so the way that carcinogens, like those found in cigarette smoke or in UV radiation, can prevent the ability of your cell to repair DNA, or they actually physically damage the DNA directly so that eventually that repair machinery is not going to be able to catch up. And so then when those spelling mistakes happen, if that happens in a gene that is important for something that keeps cancer at bay or is itself, a process that is involved in repairing the DNA. So if you have a mutation in a DNA repair gene, more and more and more mutations will happen, and that can be how cancer can start.
And we did have another question from Tom that I'll go ahead and address this right now. And I'm not sure if I'm pronouncing this correctly, so you guys will have to check my pronunciation. Does Tom wanted to know if Precision Health, if it checks methylation status, is that correct?
Yeah. Yep.
Okay.
Yep. So let me explain what methylation is. So our DNA can be kind of decorated with different modifications, and one of those modifications is called methylation. And so what methylation does is controls the expression of certain genes. So if a gene is supposed to be off, then it will have a lot of these decorations on it so that it doesn't turn on when it's not supposed to. And so let's say that that gene makes the cell divide and methylation is disrupted. And so that gene that's supposed to be off turns on, and now that cell is told to divide and divide and divide. That can be something that can lead to something like cancer. So it's one of the newer areas of genomics and omics in general and precision health that's very, very cutting edge and is coming to the forefront, but it's not commonplace today in most areas.
Yeah.
I'm just impressed that he knew that word. So, all right, thank you so much, Tom. I appreciate it. Gosh, you guys are on a roll. You got a lot of calls tonight. So Janice also called in. She wanted me to ask the question for her. She wants to know, can pH test for Alzheimer's?
So pH, I'm guessing that that pH in this case stands for precision health. Yeah. Can it test for Alzheimer's disease? Well, it's a great question. And what I would say is certainly there are genes that we know if they are mutated in an individual, so if they're changed in an individual, that they can be associated with increased risk for things like Alzheimer's disease or dementia.
Yeah.
Similar to the cancer risk genes, though, just having the mutation by itself doesn't in everyone predict that that person will definitively get Alzheimer's disease. So again, there are things you can do that may help to modulate or attenuate your risk. But certainly that is a huge area of study and such an important area that would be wonderful if we could identify those individuals earlier.
I was going to say, I was talking to a friend about what we were going to talk about on the show tonight, and she said, you know what, I don't know if I'd want to know. She said, I have so much anxiety anyway, and I said, well, in some cases, it's nice. Like I look at, we had a relative who, when my cousin was pregnant, they found out halfway through the pregnancy that their little girl had a cleft palate. And she said, I'm so glad we know. They lined up a surgeon, they went and consulted with him beforehand because it was severe. She couldn't eat when she was born. And she said, I can't even imagine trying to deal with that the minute she was born. The emotion would get, it would have been a disaster. And so, I've met people that are like, no, I'm so glad I knew that this is something that was going to happen or could happen. So I can see where, I'm on the fence about it too, as much as I want to be as proactive as possible. I can see where it can be a little scary, or people would just worry, themselves into a frenzy about, oh my gosh, I'm going to have Alzheimer's someday.
Absolutely.
How do you address that with the patient? I'm a worrywart, so maybe it's just me.
We both are too.
Yes.
Absolutely. And I would say it's a really personal decision, right?
Yeah.
Whether someone wants to have this kind of information or not is very personal. The side of me that advocates for it and the part of me that supported myself to go ahead and have genetic testing is that by having the information, I feel empowered. Right?
Sure. Yeah.
Similar to your friend with the child with the cleft palate, I feel empowered to be able to take action to support myself to stay healthy. Not having the information doesn't change your status. It just changes your ability to take action earlier. So, I don't know what
any advice from you, Dr. Powell?
Exactly that. I think that the idea is being proactive enough that you can, ideally prevent disease altogether, but at least potentially catch it early. So we know that when, again, to use the example of cancer, when cancer is diagnosed late, after it has already spread, it tends to be a terminal diagnosis. And so, because it can no longer be surgically removed, and there are too many genomic changes and therapies are less effective. But if you have a risk factor and you do get into screening programs sooner, then you can potentially catch that disease while it is still in a curable stage, or at least a very treatable stage. And that's important, especially because usually when screening programs like mammograms, for example, those tend to be covered by insurance according to medical guidelines that say at age 40, women now qualify to get their mammogram. Right. But if a woman knows that she has a mutation in a BRCA1 or BRCA2 gene, then her insurance might actually pay for that mammogram before the age of 40, with the idea being that they can catch that cancer a little bit sooner.
It's a fascinating topic, and sadly the show is already over, so you both of you need to come back. We could do an hour-long program easily. So, Dr. Renbarger, Dr. Powell, thank you so much. Pleasure to have you on. So really, I know I learned a lot, and thank you so much to everyone watching. We had some really good questions tonight too. So I'm still impressed that the one guy knew methylation. Yeah, I already forgot it. I'm Jennifer Blomquist. Have a great night. And again, we'll be back next week talking about integrative medicine. Take care. Bye-bye.
The preceding program on PBS Fort Wayne is made possible in part by...
You gotta find your people.
Good morning.
The ones that make you feel whole.
Good. How you feeling?
You look so pretty today.
When you get together, you got nothing to lose.
Good job.
In a world full of strangers, you don't know who to trust. You can't go it alone. Everybody needs help.
Go.
You gotta find your people, then you'll find yourself.